All right, it is our favorite time of the week. It is Friday, it's 4:45. This means it's Facebook Live at Rockford Family Eyecare. My name is Dr. Theodore Sees, and I'm going to walk you through what it's like to when you come and visit Rockford Family Eyecare, or when you have an eye exam, or the process of what we do here at Rockford Family Eyecare. So, come with me. I'm going to kind of introduce you to some people. So this is Stacy. Stacy is manager and our head receptionist. She's going to kind of explain to you what happens when somebody comes to the office.
Okay, when you come in, you're going to see me first. I'll welcome you into the office, and we will take your information. We will confirm your birthday and your home address, phone numbers, and emails. We will also take your medical and vision insurance information, get you all checked in, have you fill out a couple forms that'll look like this. And then I will let you know that we do have coffee, tea, and water available, and usually some home-baked cookies made fresh from the doctors. And you can have a seat and wait for the doctors to come and get you.
And then what we'll do next is, if we have a little extra time, we always recommend patients go ahead and look at some of the optical to kind of get an idea of what they like or what their interests are when it comes to glasses. But what will happen is usually someone will guide you into the pre-test room. And the pre-test room is where we take all that information and take it and send it to the doctor, because the doctor uses that to actually further the exam. So come with me. We're going to go into the pre-test room. Here we have Melanie. Melanie is our office manager, and she's going to be testing me, or pre-testing me, once again, getting me that information for the doctor to use to actually finalize prescriptions.
Yeah. So this is our autorefractor. This gets a baseline prescription for the doctor to start off from. And you don't have to worry, all it does is shoot a light into your eye, not a puff of air. Neither of these pieces of equipment do that. What this one is, this is our fundus photographer. It gets a picture of the back of your eye. It shows the doctor your optic nerve and all the blood vessels that run through the back of your eye. It lets them see if there are any eye diseases or medical conditions that possibly need to be addressed at the appointment.
Great, so once we have this information, we're going to relay all this information to the actual doctor. So once again, we'll come down the hall. And then this is our Dr. Carrie Sees.
So this is where we do the exam. I have the patient sit down here. We do a bunch of tests that I'm not going to go over right now, but I do a bunch of tests and I go over case history, just meaning I ask him what is going on with his eyes, seeing if he has any problems, see if he needs glasses or contacts. And after we do that, and I get an idea of what we're going to be doing in the exam, I come over here and I do the fun refraction that everybody just loves. And I put this up, and then I have him looking at the screen, and I give him choices. Which looks better, Ted? 1 or 2?
2, definitely 2.
Okay, I'm going to give it to you one more time. Here's 1 or 2.
It's 2.
It's 2. Okay, great. So, pretty easy. After I do that, I do the health check on his eyes. So oftentimes we've done photos in the other room, so I pull up the photos here on my computer to get an idea what the back of his eye looks like. And then I bring my slit lamp over here. The slit lamp just magnifies everything in his eyes. And I do a check of his eyes real quick. After I see things look good, I decide to check his eye pressure. Here at Rockford Family Eyecare, we don't do the air puff test because people hate that test. We do another one called the eye care tonometer. It's much easier and quicker to do and more comfortable. After I do that, I grab my dilating drops and I dilate his eyes. And then after I do that, we are going to head over to the contact lens area because Ted decided he wanted to do contacts. So we're going to head out this way.
Perfect.
And I bring him over to Andrea. Andrea's going to take over from here. I give her the prescription of the contacts I want her to go over with him, and she's going to show him what to do.
Okay, so first I would have them wash their hands, and then I would have them take a seat right here. And what I basically do is I teach them how to insert contacts and remove them. There's all sorts of different types of contacts that we use here. We do hard and soft contacts, and there's different ways to do that. So I teach them, make sure that they're fully capable of doing it on their own, and otherwise we schedule them for a follow-up for that. But yeah, and I teach them the care of contacts. You have to take care of contacts so they don't get bacteria or anything like that on them. So
Andrea's awesome. All right, so moving on, we'll go on to I want glasses too. So I'm going to talk to my head optician, Ben, and we're going to see what his thoughts and suggestions are for glasses here. So the doctor told me that I have a little bit of astigmatism, I have a little bit of nearsightedness, and so we bring all that information to Ben, and then Ben, based upon his knowledge, is going to kind of guide me in the right direction.
We can do, once we've got the information from the doctor about prescription, we can do, 17, 18, 20, however many different pairs of glasses. It all depends on what fit you like, what look you like, we can decide what looks good in a particular frame and what doesn't, and make sure that your eyewear is the best we can make for you. Then once we get all the orders put in our computers, we order up lenses, and just recently we got ourselves our own edger. So now not only do we order your glasses, but we cut the lenses as well. It gives us one more level of quality control over the finished product, and just gives us great results a little bit faster than we can do without. I'm going to turn you back over to Doctor, and he's going to let you know how life goes.
All right, so now that we've kind of wrapped it up on what it's like to be a visitor at Rockford Family Eyecare, it's pretty harmless and it's a lot of fun, and we try to make this very professional, but we try to make a lot of fun. From the cookies to our fun staff, we really have a really good time here. So if you have any questions, feel free to give us a call. Remember, first person to comment about which one was clearer for me, 1 or 2, will win a $5 Big B gift card. And if you have any questions, you can always call us. My name is Dr. Theodore Sees with Rockford Family Eyecare. We will see you next Friday at 4:45.